Hi everybody, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. And although it's late and I'm tired, I felt the need to respond to so many questions that I received tonight from people asking me what to do as they were recently diagnosed with cancer. I certainly appreciate everybody having the confidence in me to value my opinion, and I will do my best right now to give you some guidance. Receiving a cancer diagnosis is undoubtedly a life-altering experience that, unless we're faced with it, we really can't understand. And I know it leaves patients feeling overwhelmed, frightened, and uncertain about the future. In the midst of the turmoil, it's imperative to engage effectively with your healthcare team, and it's most important for you to find a really good oncologist that you relate to. One of the most constructive ways to maintain a sense of control during this challenging time is by asking insightful questions to gain clarity about your condition and treatment options. So I'm going to delve into 5 essential questions that you need to ask your oncologist. Each is designed to empower you with knowledge and foster informed decision-making. Number 1, you need to ask what kind of cancer do you have and what is the stage. This is the most crucial question to pose to your oncologist, and you need to know the specific type of cancer because there's multiple lung cancers, obviously there's multiple lymphomas and leukemias because cancer is not a monolith. It encompasses a wide array of diseases, each with its own unique characteristics. Understanding whether you have breast cancer, lung cancer, leukemia is fundamental because it determines the treatment regimen, prognosis, and potential outcomes. Next is staging, which refers to the classification of cancer based on tumor size, location, and whether it is spread to nearby lymph nodes or distant organs. And this is equally as important. This is what we call the TNM staging. Knowing the stage aids in understanding the severity of your condition. For example, early stage cancers have a higher chance of successful treatment and cure. And these details are crucial for establishing not only your treatment plan, but also getting you mentally prepared as you navigate a difficult journey ahead. Second question, is my cancer curable? And this is often the most difficult question to ask because it's at the forefront of your mind when faced with a cancer diagnosis. But you must ask your doctor this question. And if so, what are the odds of achieving remission and cure? I tell my patients that essentially a cure means that there is no evidence of cancer while being off all treatments for 5 years. Your doctor will consider factors such as the type of cancer, its stage, and your overall health while addressing this inquiry. In many cases, oncologists may suggest a treatment plan aimed at not just managing, but potentially eradicating the cancer completely. Understanding the likelihood of a cure and the pathway to obtaining it can help you cultivate hope while preparing for the realities of treatment. If curability is not a viable option, discussions, no matter how hard they are, about palliative care and strategies for maximizing your life and the quality become essential. Okay? So the third question now, will treatment help me live longer? And if so, will it help me live weeks, months, or years? When undergoing treatment, the question of longevity looms large. Patients desire to understand the impact of various treatment options on their life expectancy. Therefore, asking your oncologist whether the proposed treatment might extend your life and by how much is absolutely crucial. Your oncologist will provide insights based on your specific cancer type, treatment plan, and emerging research. This inquiry might involve discussions about survival rates, potential treatment outcomes, and even participation in clinical trials as an avenue for extended care. While projections might not always guarantee certainty, they can afford you a framework for setting realistic expectations and making informed choices about your care and lifestyle moving forward. The fourth question, what are the side effects and other options? Cancer treatments often involve a spectrum of side effects, and it is essential to discuss these openly. Asking your oncologist about potential side effects allows you to prepare emotionally and physically for the process ahead. Knowledge about the adverse effects such as nausea, fatigue, hair loss. There's a multitude of them. And impacts on your mental health can help you triage your expectations and provide a sense of control during treatment. Moreover, inquiring about alternative or complementary therapies is equally important. Your oncologist may offer insights about therapies that can be used alongside conventional treatment or alternative approaches that can be complementary and align better with your health philosophy. The key is to maintain an open dialogue about your preferences and values as you navigate your treatment journey. But please, don't disregard conventional treatment. 5. Where will I spend my time in the next 6 months? Lastly, it is critical to consider the logistical aspects of your treatment. Understanding where you will receive care, whether in an outpatient facility, a hospital, or through home-based options, can help you plan your time and support networks. Your oncologist can provide guidance on the schedule for treatment, follow-ups, and any necessary lifestyle adaptations. This question also invites discussions about your overall mental and emotional well-being as you anticipate the changes that will unfold in the months ahead. Perhaps more importantly, it allows you to articulate your desire for a treatment approach that respects your lifestyle and supports your interests outside of your disease. So in summary, the journey of navigating a cancer diagnosis is paved with uncertainty, complex choices, and ups and downs from an emotional standpoint. But by equipping yourself with these 5 inquisitive prompts, you foster a productive dialogue with your oncologist, empowering yourself with information while alleviating some of the fear and anxiety associated with the diagnosis. Remember, knowledge is not only power, but it's a crucial ally in the pursuit of hope and healing. And if I stress one more thing, and I will say it again, complementary medicine is just that. It complements. And I know you have tremendous pressure from people on TikTok, for example, who tell you to do this and tell you to do that. But most of them are anecdotes. And anecdotes are great, but they're unique to every person. So if you trust your oncologist, you develop a plan and start out and proceed in that direction, and you can always alter course. Okay, so with that, I hope you learned something, and I did my best to give you my thoughts and some guidance. I hope you have a good evening, and if you need more information, you can go to my website at www.paladinmds.com, and I hope everybody gets some sleep tonight. Thank you.